When you are trying to answer question on the NCLEX exam, right, you want to pay attention to three things. You want to pay attention to the body of the question, you want to pay attention to the stem, you want to pay attention to the answer keys, right? You are going to hear me saying this every time because it's very important. Now, the body of your question contains the content, the stem contains the examiner question, and your answer key, you cannot be able to break it down or let it give you extra understanding first before you start breaking it down. Now, this is the body of your question right here, right? This body of your question is testing you on a specific content. You need to understand that content first before you read the stem, which is the examiner question. If you read the body of your question, you will notice it's not a question. It's just like telling you what is going on. Am I making sense? Now, look at the body of the question saying, the charge nurse must transfer a female client from the medical surgical unit to the maternity unit to make bed available. That's the information we have right now, right? A charge nurse must transfer a female client from where? The medical surgical unit to maternity. Now, let me tell you something. On the NCLEX test plan, remember, I always used to say this. If you watched previous of my video, I always used to say this. Before you attempt the NCLEX exam, you need to be aware of the content. Where do you get the content? Question bank don't give you the content. So forget about question bank. Focus on the NCLEX test plan because the NCLEX test plan contains the content for both RN and PN. Right, so go get the test plan so that you can know the content. Now, one of the contents, right, is transfer. You will see a particular session under management of care that talk about admit, transfer, discharge. So NCLEX is testing you related to transfer. NCLEX want to test your ability to transfer appropriately. Now, there are various reasons why we transfer clients. Now, but let me tell you two reason why we transfer clients. Now, we transfer clients sometimes to give them what advanced care, and we transfer clients to make bed available. Now, when you are trying to transfer a client to give them advanced care, you are looking for clients that are not stable. But if you are trying to transfer clients to make bed available, such as this question right here, right, we are trying to what transfer client that is stable. So now you can see the two type of transfer, but one is related to what? Critical patient. Another one is related to stable patient. Am I making sense? So now, when I see this particular question, I know it's all about transfer. That is one. Two, my mindset is now trying to now see if the NCLEX is trying to test me related to advanced care or making bed available. Now, this question is testing me related to what? Making bed available. So now I know if I'm going to transfer any client from this list, it's going to be related to a stable client. But let me see what the examiner is saying. So I need to read the stem because the stem of the question contains what the examiner is saying. The stem is saying it will be most appropriate for the nurse to transfer the client. You can see NCLEX is trying to test if you know the most appropriate client. Now, how do you get to know the most appropriate client? One, you need to understand what the body is asking. The body is testing you on transfer, right? But as a nurse that is ready to pass the NCLEX exam in its 5 questions, you need to also now reflect and ask yourself, what kind of transfer are we doing? Are we transferring to give clients a better care, or we are trying to transfer to make bed available? Transferring to give clients advanced or better care, you are going to look for what? Critical patient. But if you are transferring to make bed available, you are going to look for what? A stable client. Am I making sense? So that would be your most appropriate. So the NCLEX is testing your bed available. So the most appropriate client will be client that is what? Stable. Now, how do you know a client that is not stable and a client that is stable? Remember, I always used to say, when you are trying to prioritize, never prioritize using the patient condition. Prioritize using what the patient is experiencing. Now, this is the patient condition, we don't prioritize using the condition. This is the patient condition, we don't prioritize using the condition. This is the patient condition, we don't prioritize using the condition. This is the patient condition, we don't prioritize using what? The condition. We only prioritize using what the patient is experiencing. So this is what the patient is experiencing right now. This is what the patient is experiencing right now. This is what the patient is experiencing right now. And this is what the patient is experiencing right now. Now, I always used to tell my students, right, in my coaching program, this. You need to understand, because this is like prioritization. Now, one thing a lot of students don't know is this: prioritization can be tested in different form. It's not only when the NCLEX is saying who should you see first. That is not only how prioritization is tested. The moment you are deciding what kind of treatment to give, that is prioritization. The moment you are trying to delegate tasks, that is prioritization. The moment you are trying to prioritize procedure, that is prioritization right there. So the moment you are trying to transfer a particular client, that is also prioritization. Sometimes prioritization make you prioritize what are they calling it? A stable client, such as this situation right here. Am I making sense? So now, any prioritization, you don't want to use the condition, you want to use what you're experiencing. Now, one thing you want to know is when you are answering prioritization type question, you need to know the components that you have. Right here, we have a condition. And what do we have right here? We have intervention. Right here, we have a condition. We have what? Intervention right here. This is intervention right here. Right here, we have a condition. We have what? This is not an intervention. Instead, this is what the patient is what? Having, maybe whether it's related to sign and symptom or the patient is stable. NCLEX is trying to describe it here. Now we have a condition right here. Guess what? This is an intervention. So this is an intervention, this is an intervention, this is an intervention. This is just related to how the patient is, what the patient is experiencing, related to either they are experiencing any sign and symptom or they are stable or not. That is what NCLEX is trying to describe. Right now, what we are seeing right here is an intervention. In order to know if a patient is stable or not, when there's an intervention that is done, you need to evaluate if the patient is stable. Now, this particular question, number one, is having that intervention, but the NCLEX is not telling us if they are stable or not. So it means that this patient needs furthermore assessment. I cannot transfer this patient as at yet. Now, and two, guess what? If the NCLEX is not telling us this patient is stable, right, based on the intervention, I cannot transfer them to maternity unit because this situation right here that we have is best managed in the surgical unit. Am I making sense? Now look at this one. Now, the keyword right here that is making you not transfer this client is what I highlighted now. Begun. Somebody just began receiving insulin and you want to transfer the client to maternity unit. Let it make sense, because this patient need assessment. They just started their insulin. You cannot. This patient is considered unstable until they are stable, because they just started the insulin. So you cannot transfer this particular client. Now look at number 3. It's saying the patient is what? Afebrile for 24 hours. Now, are you thinking what I am thinking as well too? Because afebrile means what? No fever for 24 hours. Now let's even flash back to what the patient's condition is. The patient condition is hepatitis C. That's an infection. Now NCLEX is not saying this patient don't have what? Fever for 24 hours. Now there's one rule for a patient that is stable. Now if a patient is stable, no, this is it. Listen to me. If a patient is free from any sign and symptom, or their vital signs are within range for 24 hours, those patients are considered stable. You can discharge those patients, you can transfer those patients to make bed available. Now, patient 3 fall in that particular category. Right. There are other rules also to know if a patient is stable, but that's just one thing, and these patients definitely fall in that category. So number 3 is stable for transfer. But look at number 4. They still have their external fixation device. Let me tell you something. Anytime there's an intervention, you need to evaluate. We gave this patient insulin. This patient is at risk for hypoglycemia. We need to evaluate. So if the question is not telling us this patient is stable, after that intervention, trust me, we cannot transfer that patient. These patients had their closed wound drainage. They need assessment. You need to monitor for the drainage. You need to monitor everything is working well. NCLEX is not telling us anything like that, so definitely that patient we cannot transfer. Same with this last one, number 4, which is talking about the external fixation device applied 48 hours ago. Yes, it has been applied for a long period of time, but the question is, where is that statement that is telling us this patient is stable? Because they still need assessment, right? Because when there's an intervention, think about it this way. If you give a patient medication for a particular condition such as hypertension, you need to evaluate, because if there's no evaluation, then you've not done your nursing job. So if a patient return from surgery, we put them on closed wound drainage, guess what? We need to assess. So the assessment needs to appear. The moment NCLEX is telling you assessment is not there, right? If the moment NCLEX is not including assessment, it means that the NCLEX is still trying to tell you this patient need assessment. Receiving insulin, they need assessment. External device, they still need assessment, right? But the patient that have no fever for 24 hours, that patient is 100% what? Stable. So the correct answer to this question is what? 3. Right. So if you are struggling to pass the NCLEX exam and you need help in passing the NCLEX exam, yes, I made this company in order to help you to pass the NCLEX exam. So reach out to me. I'm going to call my number, right? +1767 613 0769. +1767 613 0769. Right, listen, I have helped over 700 plus students pass the NCLEX exam in 85 questions, and I want you to be part of that number. I don't care if you failed the NCLEX exam multiple times, right? I have a particular student who failed the exam 14 times and passed on her 15th attempt. If she can pass the exam, definitely there's nothing stopping you from passing the exam. You just need to understand how to break down question, and trust me, that is it for you. You are passing the exam. Right, so I'm going to give you the knowledge you need, the content you need for passing the NCLEX exam in 85 questions. So text me right now and I'm going to get back to you.